Hi there, and welcome to Student Midwives Nook. Today we will be tackling topics under infant care and feeding, and that will be the initial care for newborn. But mainly in this video, we will be tackling the vital statistics only. So let's start now. When we are talking about vital statistics, we are talking about weight, length, head circumference, and chest circumference. Now let's start discussing the weight. Now, weight varies on races, nutritional intake of the mother, throughout the pregnancy, intrauterine factor, and genetic factor. You have to remember that usually the second-born children weigh more than the firstborn. Why is it so? Obviously, because the uterus already housed a baby or a fetus. Now, the lower limit of the normal for all races is 2,500 grams or 5.5 pounds. Now, when we talk about the range of normal for all races, so it ranges from 2,500 grams to 4,000 grams. So anything in between these numbers is normal. Now, the range of normal in the Philippines is 2,500 grams to 3,500 grams or 5.5 pounds to 7.7 pounds. Now, if the baby is born or more than 4,000 grams or more than 8.75 grams, that is a condition known as macrosomia. Now, if the newborn is macrosomic, there must be an underlying cause. There must be a possible maternal problem, and it might be gestational diabetes mellitus. Now, if someone or, if the healthcare provider delivered a macrosomic baby, it'll automatically be suspected that the mother, again, has GTM. Now, the newborn baby loses 5% to 10% of the birth weight during the first few days after birth. And that is totally normal. Now, let's discuss some more about weight. Now, weight loss happen due to no longer under influence of salt and fluid-retaining maternal hormones. Now, diuresis happens or begins on the second or third day of life. These are the measures that reduce weight. So when the baby voids or the newborn voids and the newborn passes the stool or the first stool. What is the first stool again? That is the meconium. You are right. Now, breastfed babies recaptures its weight after 10 days, and formula-fed babies gain within 7 days. Why is it so? Ang breastfeeding mas healthy kesa sa formula-fed, as they say, because breastfeeding or breast milk is the golden milk. You know why? Because there are some adjustments, no, in the process of breastfeeding a baby. Adjustment from the mother and adjustment from the newborn. Now let's move to the length. I'm sorry, the birth weight principle first. Now, as a future board examinee, let me share this to you. Itong birth weight principle, ito ay favorite na itanong sa board exam. This is mostly asked or frequently asked during board exam, the birth weight principle. Now, you just have to remember that at the 4 to 6 months of age of the newborn, the birth weight will double up. So let's say we have this example, 2,500 grams, yan ang birth weight ni baby. And pagdating niya ng 4 to 6 months, nag-double up na ito. So, ilan na siya? It'll be 5,000 grams. On the 12th month of the baby, the birth weight again will triple up. Huwag kayong magkakamali, this will not triple up, no? Hindi yung weight niya ng 4 to 6 months, but the birth weight. So, the answer here is approximately the newborn at its 12 months na will triple up the birth weight. So, that will be approximately 7,500 grams. Now, at 2 years and 6 months of age, the birth weight will quadruple or be times 4. Now, for our example, 2,500 grams, pag ito ay nag-quadruple na, the value will be 10,000 grams. Now, you have to remember that the newborn begins to gain weight about 2 pounds per month for the first 6 months of life. All right? So that is the concept of the birth principle. And now finally, let's move on to the length. Now, here is what you have to remember when we are talking about the length. The range in normal in length is 45 to 55 centimeter or 18 to 22 inches. Now, the average is 50 centimeters. Now, the technique is to lay the newborn baby supine with legs extended and measure it from the heel to the vertex of the head. And so again, the position is supine, just like here in our illustration with legs extended. Okay, let's move to the head circumference and the chest circumference. Now, here are some pointers or important pointers to remember when we are talking about the head circumference and the chest circumference. So, the normal range of head circumference is 33 to 35 centimeters. Head circumference is larger than the chest circumference by 1 inch or 2.5 centimeter to 3 centimeters. Now you have to remember that by taking the head circumference, of course, you have to use the tape measure. Okay, so how can you do that? How will you obtain the head circumference? By drawing across the center of the forehead and around the most prominent portion of the posterior head, also known as the occiput. Now, moving forward with the chest circumference, it is measured at the level of the nipples. Okay, if edema is present, measurement will not be accurate. So you have to wait for the edema to subside. The chest circumference is measured at the level of the nipples or at the edge of the scapula. Ayan. Directly to the line of the nipple area anteriorly. Ayan, sa harapan daw. Ayan. Now, minsan, ito yung makikita nyo sa choices. So, ito yung sagot on how to obtain the chest circumference. Now, that's all. See you on our next video. Happy learning!